Hello everyone. Today, Hello everyone. Today we are going to discuss about in vitro fertilization. We are going to have a brief idea of what in vitro fertilization or what IVF exactly is. So first of all, introducing the topic, you must know that IVF is a series of procedures that can lead to pregnancy. Along with this, it is a treatment for infertility, and in most of the cases, it is the most reliable treatment for infertility. It is also used to prevent passing on genetic problems to your child. It is not always necessary that if the situation of infertility is there, then only IVF is chosen. But imagine there is any genetic problem in the parents, and the parents don't want the genetic problem to transfer to their child. So in that case also, parents can go for IVF. So what happens during IVF? During IVF, the mature eggs are collected from the ovaries and fertilized by the sperms in a lab. So you must know that the reproductive part that is responsible for the process of fertilization for making the embryo. What is embryo? Embryo is the fertilized result of the egg and the embryo. Egg is taken from the female partner and sperm is taken from the male partner, and the two are fertilized in a lab or a artificially created environment that is suitable for developing the embryo. Then one or more fertilized eggs called embryos are placed in a uterus where babies develop. So when these embryos are fertilized, when the egg and the sperm is fertilized, they form embryo. And it is not always possible that only one embryo will be formed. More than one embryos are also formed. So in that case, one or more than one embryos are implanted in the uterus. The main reason why more than one embryos are implanted is to ensure the successfulness of the procedure. It is not always possible that if we have implanted only one embryo thinking of a one single uterine child, it is not always possible that it will be able to develop into a full fetus. So that is why more than one embryos are implanted, and this is the main reason why most of the times IVF results into twin or triplet pregnancies. And one full cycle of IVF takes about 2 to 3 weeks, or sometimes even longer, depending upon the situation of the parents, depending upon the health status of the mother or the father, that whether the egg or the sperm that we have received is healthy, is mature or not. IVF is the most effective type of infertility treatment. IVF can also be done using a couple's own eggs and sperms or from an unknown donor. This is also an important point that you must know that for IVF, it is not always necessary that both the partners have to give their egg or the sperm. For example, if there is any issue with the male partner or with the female partner, so the egg or the embryo can also be taken from a donor person who will be donating the egg or the sperm depending on what is the need of the parents. In some cases, a gestational carrier is also taken in role for the implantation of embryo. Now, for example, there are many women whose uterus is not able uh, to carry the embryo to form into a fetus. There may be some abnormality in the uterus, some anatomical abnormality may be there, or any kind of cyst or cancer may be there, or TB of the uterus can be there. So, in such cases, a gestational carrier, also known as a surrogate mother, that we usually know in the common language, is used for the implantation of the embryo. And IVF, this has to be always kept in mind if you are going for the IVF, that it can be time consuming, expensive, and invasive as well. And it also results to multiple pregnancies, as we have discussed it earlier also. So in short, this is the process of IVF. Number one is ovarian stimulation. First of all, the ovaries are stimulated to release eggs. Then the eggs are retrieved and the sperm are collected. So egg is retrieved from the female partner and the sperm is collected from the male counterpart. And after that, both the egg and the sperm are fertilized. And after fertilization, what forms is the embryo. After the embryo is cultured, the embryo is transferred into the uterus of the female partner or the surrogate mother in other cases. And then when this embryo is transplanted successfully in the uterus and it starts to grow, then this leads to pregnancy. If the embryo is successfully implanted in the uterus, then you will see the positive pregnancy results. So in short, this was the process of IVF. Now, in further slides, we will be seeing in detailed description. So the next video will be of why IVF is done. So what are the reasons why IVF is done? This we will be discussing in the next video. Thank you so much.